Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute. We are here with Dr. Zahra Figueredo once again. How are you, doctor?
I'm very well, Luis. Thank you so much. How are you today?
I'm doing great. We do have a very interesting topic today. Maybe some of you have been waiting for this podcast because we are gonna flow with questions to the doctor, and it's a Q&A podcast today. So doctor is gonna be answering some questions that we're gonna do. That usually most of our patients ask these questions, right, doctor?
That's right. So they're usually the frequently asked questions, as we call them. Absolutely.
Exactly. So, doctor, I believe this is like the most frequent question you get. What do you practice in Guatemala?
That's a very important question, Luis, because we get asked that question a lot. Because a lot of our patients come from North America, so they wonder very often, why can't I get this treatment in the U.S. or why aren't you guys based in the U.S.? And the reason being is that the laws are very limited for stem cell treatment in the US and Canada, among other places in the world. The FDA puts very strict guidelines as to the practice of stem cell treatments. Those include number one, the stem cells have to come only from the patient's own body, so they have to be autologous. Number two, they can't be combined with any other component from your blood or growth factors or any other nutrient that might allow for the treatment to be much more efficacious. Number two. Number three, the stem cells can't be grown or manipulated in any way. So whatever numbers are isolated are the numbers that have to be deployed. And the stem cells have to be deployed, or the treatment has to take place all in one session or in one day. So that really limits the results. It limits the outcome. It limits what we can actually obtain from a very extensive treatment. So that's the reason why we're here in Guatemala, because of the laws. They're very liberal. It allows for us to do a very safe and effective treatment without breaking any laws, basically.
So, doctor, is this treatment FDA approved?
So, Louise, I'm glad you asked me that, because there is really no known FDA-approved stem cell treatment in the world, even in the U.S. It is not allowed by law to the way that we do this treatment. Of course, outside of the jurisdiction of the FDA, being in Guatemala, there really is no FDA-approved stem cell treatment even in the U.S. FDA approval would signify a lot of other criteria that stem cells just haven't met yet. They can't be patented. The procedure or the stem cell themselves cannot be patented. So there are a lot of criteria that FDA, we can get into the technicalities, but it can get complicated. So no, in essence, we are not FDA approved. There is no FDA approved stem cell procedure anywhere in the world. And that is one of the reasons why we are outside of the USA.
Do you think being in Guatemala gives you the chance to provide better prices? So what I want to ask you is, the cost is better here in Guatemala than if you do it in the United States or Canada?
Yes, let me explain my answer. I say yes, and that is number for number. You may get a treatment in the U.S. that might be $10,000 versus our numbers, but what you receive in return is comparing apples to oranges. Like I explained in the first question, the extent of the treatment, the numbers of stem cells that are deployed, the types of stem cells that are deployed, in most cases We use more than one type of stem cell, depending on what we're trying to accomplish. Also, the combinations in the cocktail. So we do a proprietary stem cell cocktail that contains different growth factors, stem cells, other proprietary ingredients. We also employ a pre and post treatment protocol that lasts almost 3 months. And we also include accommodations and a driver, a personal driver. So it is a very all-encompassing package and for what you receive. And in being in Guatemala, it allows us to be very, very ethically priced. So if you were to compare with other places in the world that are outside of the U.S. as well, for somewhat of a comparable treatment, it's still comparing almost apples to oranges because we have not found any other clinic that provides the level of care and comprehensiveness that we do. And so we remain very ethically priced for the value added for what you receive in return. And being in Guatemala affords us that luxury of trying to make this treatment a lot more accessible to more people.
Okay, and based on that, what would be like the baseline for prospective patients for a budget to receive stem cells?
Yes.
Or any other treatment here?
It varies. It varies depending on the treatment, depending on the condition, the patient, what exactly are we trying to accomplish. For instance, a patient with spinal cord injury will require much more in-depth level of care as opposed to an injection in a knee, for instance. So let me expand on that a little bit. So with a spinal cord injury, we would do an intravenous infusion of stem cells with mannitol to bypass the blood-brain barrier. We would also do an intranasal aspiration of stem cells, again, to get the stem cells to the central nervous system and the spinal cord, again, bypassing the blood-brain barrier. And then we may do an intrathecal injection of stem cells, where we place the stem cells directly into the cerebrospinal fluid that surrounds the spinal cord. So a lot of this requires an OR. It requires other specialists. So in those cases, the price tag is a little bit higher, whereby a knee, as I mentioned earlier, might just be several injections with an ultrasound to the knee and just not so in depth. So the price tag is lower. The prices usually start for the all-inclusive, comprehensive package of the pre and post-treatment protocol, accommodations, driver, everything we've mentioned. They start at around $13,000 US.
I see. So in this case, if somebody want to treat a condition, can you treat like two conditions at the same time? Would it be like an advantage for the patient?
Thank you for asking that, Luis. That is a very, very important question to address because we find that a patient often has more than one condition or more than one issue to be addressed. And economically speaking, it is much easier for the patient to have an add-on treatment as opposed to just doing treating one condition and then coming back for treatment perhaps in the future. And the reason being is that we are already going through the process of harvesting, isolation, expansion, the cocktails, the whole pre and post treatment protocol, having the patient here physically. So since we're already doing the work for one condition, it's much easier and it's a much marginal price tag to just add on another condition. Such as, for instance, we have how we often have a total body rejuvenation where it's an IV and an intranasal aspiration, and then a patient might add on a joint or a stem cell facelift or whatever, or the hair, whatever the case may be. And in that case, those add-ons are just very marginally priced, so it makes it much more economical for the patient.
Can we get a little technical here and explain the difference between stem cells and platelet lysate?
Yes, thank you for asking because a lot of people, there's a misnomer. A lot of doctors actually call platelet PRP, platelet rich plasma, they call it stem cell treatment when it's not technically stem cell treatment. Stem cell treatment is a direct injection of stem cells whereby platelet rich plasma, which is a cruder version of platelet lysate, which is what we do at the Stem Cell Healing Institute. We use primarily platelet lysate. PRP and PL, as we call them, the abbreviations, they are very different in that they're growth factors that are taken from the platelets, which signal to surrounding stem cells. Okay, so they aren't. It's not a stem cell treatment per se. It's a growth factor treatment that allows for stem cells in the area, circulating stem cells, to sort of home in on those areas that require regeneration. So that's the primary difference. Stem cells are stem cells that are literally directly injected. Platelet lysate is growth factors, very concentrated growth factors, versus platelet rich plasma. Platelet lysate is much more concentrated, um, much less number of sessions required for the same amount of treatment in numerous treatments with PRP. So that's primarily the difference. And what happens in the body is cytokines are released from a damaged cell. I've mentioned this before in other podcasts. So these chemical messengers or inflammatory markers called cytokines, they're released from a specific cell that is specific for that tissue. So when growth factors or stem cells are in the area, they sort of signal to the stem cells to come and regenerate it to this area. So it all sort of works in conjunction with that process.
Doctor, so what is exactly the difference between platelet lysate and stem cells?
Mm-hmm. You know, a lot of people ask me why would I opt for platelet lysate or stem cells versus platelet lysate, and when is it appropriate for one or the other? And I think that this is a really important question to address because there is a time and a place for stem cells and a time and a place for platelet lysate. I always recommend after evaluating and assessing a patient situation. Uh, Platelet lysate is typically used in the joints, tendons, ligaments, in skin, hair, so on and so forth. So, because platelet lysate is not stem cell treatment per se, so more sessions are required. It's not as strong, for lack of a better word, as stem cell treatment, and it comes down to, for instance, if we're assessing or evaluating a knee, if the level of damage is, say, a grade one type of damage, grade one or even two, we may get away with 2, 3, maybe 4 sessions of platelet lysate, which is much more economical than a stem cell treatment. Okay, and perhaps get the same results as one stem cell treatment. But in many cases, we would opt for the platelet lysate versus stem cells in those types of situations. Again, depending on the degree of damage, debilitation, perhaps sometimes even age, medications, and so on and so forth. So that's when we will assess and honestly deduce whether or not you really need stem cells, or would platelet lysate do the job?
So, since this is going to be like serious, because I believe there's going to be more episodes about this topic, I do want to ask you, how do you collect the stem cells?
Mm-hmm. So we have, depending on the stem cells being utilized, we we mostly use bone marrow stem cells, okay? And that's aspirated through the posterior iliac spine under a local anesthetic and a very, very mild sedation to ensure that the patient is very comfortable. If it's adipose tissue, adipose derived or fat derived stem cells, we will do a mini liposuction procedure, usually in the flanks or the love handle areas, because we just have a nice adequate padding there, or the lower abdomen. Sometimes, in rare cases, we may even go in the inner thighs. Um, But those are the typical areas where we harvest and aspirate either the bone marrow or the fat tissue. And then, of course, we have endometrial-derived stem cells that come from a very healthy young donor, the uterus of very healthy young donors. So, and that is collected accordingly as well.
Well, doctor, I really appreciate your time. And like we said before, we're going to divide this podcast in a series. Same topic, uh, frequently asked questions here. So I appreciate your time, doctor.
Thank you, Louise. I appreciate it. It's always a pleasure being with you.
You take care, doctor.
Thank you. You too.
Bye-bye.
Bye.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.